The government of Saint Lucia is seeking to maintain the success Saint Lucia has achieved with the management of COVID-19 with the passing of the COVID-19 Prevention and Control Bill at the House of Assembly on Tuesday, 29 September 2020. This bill serves to regulate the containment of the spread of COVID-19 in Saint Lucia in the interest of public safety, public order, and public health. This means that certain protocols established through the months of assessments, consultations, and discussions from the beginning of the COVID-19 threat locally, which allowed for the swift response to mitigate against and contain the spread under the state of emergency, will now become law. For example, the wearing of masks, the responsibility of establishments to declare and uphold protocols, and what to do should we have an outbreak. As he proposed the bill, Prime Minister Honorable Alan Shastney made a solid case for which the law will govern the administration of the COVID-19 response, COVID-19 protocols, certification, travel requirements, electronic monitoring, and the collection of health information.
Although the incidence of COVID-19 in Saint Lucia remains one of the lowest in the region, the threat of introduction of an outbreak, unfortunately, remains high. Following the declaration of this pandemic, Saint Lucia effectively began preparation to reduce morbidity and mortality to this public health threat. The government of Saint Lucia, through the Ministry of Health and Wellness, continues to monitor the global and regional situation and strengthen protocols to ensure evidence-based measures are used to guide recommendations and protocols as we continue to open up the economy safely.
Prime Minister Shastney noted that in the past, legislation has been drawn up to deal with infectious diseases like yellow fever and smallpox. The Quarantine Act, which exists, was made to deal with these ailments of the past, and many of them are outdated. Instead of adjusting the existing legislation, the government of Saint Lucia found it prudent to draw up an act specific to the realities of COVID-19.
However, it is necessary to introduce a bill specifically to deal with and manage the effect of and an impact of COVID-19, which continues to be a threat to our island. The introduction of a piece of legislation to manage or curb the spread of these diseases is not novel, and Parliament has in the past introduced legislation to do so by virtue of the Public Health Act, which made provisions for the management of ailments such as cholera, yellow fever, and smallpox. The Quarantine Act, which governs the management and the quarantine of persons with infectious diseases such as tuberculosis and smallpox. It would not, I repeat, it would not have been prudent to amend these pieces of legislation to make reference to COVID-19, as COVID-19 has forced us to change our way of life as we know it.
The bill also establishes the legislative framework that governs the operations of businesses within the tourism sector and provides a legal basis for the command center, which was created during the state of emergency.
The COVID-19 Prevention and Control Bill provides the legal framework to deal specifically with the COVID-19 disease outside the state of emergency.
Just as Saint Lucia is leading the region in terms of COVID-19 management, our island will be one of the first countries within the Caribbean region to enact a law to deal specifically with the management of COVID-19. Reporting for the Office of the Prime Minister, I am Danielle Dubois.